All right, Katie, we're live on YouTube.
All right. Welcome, everybody. Today is Monday, December 14th. It is 3:00 p.m. Look at us being on time today. Order. I have all three commissioners here, myself, Commissioner Hall, Commissioner Hunt. We do have a full quorum today. First up is the adoption of our consent calendar. These are items of a routine nature, but if either staff or commissioners want to pull an item for further discussion, we can do that. Otherwise, we will entertain a motion.
Madam Chair, I'll move for approval of the consent calendar as presented.
I'll ask Council Belmont to just mention item H1 or highlight that item, the SIP taxation agreement, and then I'll second it. Commissioner Hall's motion.
All right, Commissioners, Wayne Belmont here, County Council. That particular item is a continuation of the overall effort to allow a tax exemption for Georgia Pacific under the Strategic Investment Program maintained by the state of Oregon. As you may recall, we entered into an agreement with Georgia Pacific and the city of Toledo after public hearings to move forward with the application that was taken up by Business Oregon not too long ago and was approved by Business Oregon. And what remains now is with the agreement in place, the statute provides there is a 25% community service fee that is shared by all the districts, taxing districts who are impacted by this particular agreement, as you may recall. We have to have an agreement for the distribution of that 25% community service fee. In addition, we are a little unique because we negotiated an additional 10% community impact fee between the city of Toledo and Lincoln County and Georgia Pacific. And we're also utilizing this particular mechanism to distribute that 10% community impact fee. The 25% that goes to all the taxing districts will actually be distributed proportionate to the taxing authority that each of the districts has. So the bulk of that, of course, will go to the city of Toledo, which has the most at risk in tax here. For the community impact fee, what we're agreeing upon is that the money will be taken in by the county, and then through a process, the city of Toledo and Lincoln County will determine how that money is expended for things that impact the community. We identified a couple of key elements we want to look at. One is workforce housing in the area. The other is testing, additional testing that we can engage in. But that is a process that's outlined in the agreement that we'll determine on an annual basis. That money will probably not be too much and it won't come for a little while, but there'll be something that we'll be able to utilize here in coming years for specific purposes that the city of Toledo and Lincoln County determine. I do want to note this because I did have a couple questions coming from the districts related to this. The districts, while they are not part of the community impact fee, and it is, although that term is incorporated into this agreement, we would welcome input from them as well as anybody from the public as to how best to utilize that money. So we'll have a very public process for determining what expenditures will be made from those funds.
Thank you.
Okay, so I believe we did have a second from Commissioner
I second
Hunt.
it. Yep,
Okay.
I did.
So all in favor say aye. Aye.
Aye.
All right.
Aye. I'm sorry, it took me a moment to unmute. Yeah.
All right, motion carries. All right, moving under to reports. We have a lot of things to report on today. Item A, Echo Mountain Complex Fire Update. And Council Belmont, is that you starting our report for us?
Commissioners, I'd be happy to start on that report. And of course, our focus right now continues to be on the recovery efforts for the Echo Mountain Complex fire. And there's a lot of different parts to that recovery effort. One of the things that we're working very hard on right now is the transition from the Red Cross, which is providing temporary sheltering and services, wraparound services, to a system that's known as a multi-agency shelter transition team, in which the state will take over those responsibilities. and continue to provide those services to the survivors. And that's this is a program that's been rolled out in a number of other counties, and including in Lincoln County. We're really getting into it much more deeply. And I think maybe Chair Jacobson, you want to talk about, we actually have identified our local resource for that particular team.
Yeah, so as of last week, we did, I was identifying, get confirmation from that person in their department, and I think she'll be on later today under a different report, but Shelby Houston, which is part of our behavioral health program here in Lincoln County, will be our internal lead for the MAST, as well as some kind of support services, administration services, that kind of stuff will be provided by Celia August of OSU Lincoln County Extension. So I think the two of them will make a great team, and I think we'll have more to report on where we are with that kind of on the days and weeks to come here. Other counties have already started the MAST process. However, I think it's been very valuable to just hang back a little bit, because this is a new model for Oregon. It is a new model for the Red Cross given COVID circumstances. And so there has been a lot of information gained and things that I've been able to learn participating in those calls from other counties in terms of us maybe not having to tweak the model as much, because we have the benefit of learning from what they've already done. So I think we'll have more information, like I said, by next week and the week after, but we do have our leads set up, and hopefully we'll get rolling here soon.
We also continue to do our outreach to the survivors. And I know that Chair Jacobson is making regular visits to North County, as is Commissioner Hall. And tomorrow night, we actually have a meeting scheduled with survivors in which we're going to have resources, both local, state, and federal, available to answer questions, to provide information, to listen to what the concerns are of folks there, and continuing efforts to reach out to the survivor community. We do also, this is a separate process, but we also are identifying a community long-term recovery group and the component parts of that, the various partners we have in the Lincoln City area, as well as other parts of the county, to really work on some of the long-term recovery goals. Because this is a process, it's not going to happen overnight. It's going to take quite a bit of time. So we want to structure this in such a way that we're really addressing some of the long-term needs of that particular community as we rebuild. We continue to do a lot of work internally here and with FEMA in terms of accessing the appropriate funding and resources to provide all these services that we're doing. That entails a series of meetings that are happening every week with our state and federal partners. It's a process, although we've gone through the FEMA process before, never quite on the scale that we're doing now. And so that's taking a great deal of work. We're working on getting an outside vendor to assist us on financial and basically general advice on the whole FEMA structure. And that'll be coming on board pretty quickly here as we move forward. I think the other thing I wanted to focus on today on the update is that in the area of the debris management and cleanup, as we had actually indicated before last week, the folks from the state and are part of our debris management team were on site, and they're continuing to do the assessments, the kind of pre-work that's necessary before the contractor comes on board and does the cleaning. Mr. Kenyon informed me that actually, I think there's the project meeting, the kind of the rollout of the project is happening on Wednesday with the contractor in the community. So it's going to be a very short period of time before the actual cleanup is going to begin in earnest in North County. And I think that's all that I had at this point, and to be happy to answer any questions.
Yeah, let's go around and do questions or comments. Commissioner Hunt, anything to add for Wayne?
Not at this time, thank you.
Okay, Commissioner Hall?
I'm wondering if we've had any communication from FEMA about the housing mission, progress on the placement of the manufactured homes at the Fernwood property, or anything related to that?
I have a couple things I was gonna say after I had questions or comments from yourself and Commissioner Hunt. So is there anything else? And then we can jump into that.
Nope.
Okay, so yeah, I have a couple of things I wanted to add to what Wayne said. One is that both the Salmon River Grange and the Panther Creek Community Center are looking for volunteers to continue with their efforts in distributing goods and services to survivors. So both of those facilities, again, looking for help if anyone is able to do that. And they do wear masks and try to socially distance and all of that. So if you're able, you can reach out to us and we will help you make contact with them. Second, around FEMA, a couple of things, and Wayne, you feel free to jump in here. FEMA is moving forward with the Fernwood site, which is a site the city of Lincoln City owns, which I believe was maybe a failed housing development during the recession. They are moving forward on that site. There's no definitive timeline, at least that I've heard, other than they're moving pretty quickly, and they do hope to have the actual manufactured homes. They're not using trailers, they're using actual manufactured homes. They hope to have those at least up to the area, maybe not put in place, but up to the location or in proximity to the equation, I think by early January. But no timeline on when exactly they're going to be hooked up and able to be have people in them. They still have to go through inspections and that kind of a thing. The other thing I just wanted to add and kind of do a shout out to the community that may be watching this is they did contact us last week to say that they are still looking for potential additional sites to put more manufactured homes on. They have seen an increase in numbers from what they were expecting in terms of people that wanted to take advantage of the direct housing mission, which means FEMA providing housing. And they do not think they can fit all of the manufactured homes on this one site. So they are trying to look for any other potential sites. We already gave them basically all the sites that were publicly owned, sites by the tribe, sites by Lincoln County, by the state, by the city. All of those, for one reason or another, are not going to be able to be used, as well as all existing trailer parks. We also gave them those. Those are not able to be used. So we're really kind of looking in the private sector now. So if anyone is listening there and has a site that may be able to be used that is out of a floodplain, please connect with us and we'll connect you up to FEMA. I don't know much more about exactly how much space they're looking for, but we did tell them we would at least try to put the word out to the public for them to hopefully get back to us if they have sites that might be used. Besides just bare land, they're also continually looking for places that already possibly have homes on them that maybe need repairs or something like that, so that they could be used for a long-term lease. So that's what I know about FEMA at this point, and Wayne might have more information to provide as well.
No, that's a very up-to-date set of information on the direct housing mission.
Anything else, Commissioner Hall, on the housing, or did that help?
That answered my questions. Very helpful. Thank you.
Okay, great. Anything else from you, Council Belmont, on the fire?
That's it on fire.
Okay, so I guess we'll move on to Lincoln County Public Health COVID-19 update. I see Florence, so I think she's maybe providing, actually I see both of you, so I'm not sure if it's Florence or Director Austin providing our update today, but I'll turn it over to the two of you to take it from here.
And we're going to do a tag team approach. I'll take the lead, and Rebecca is in a feeling what I'm missing. Good afternoon, everybody. Florence Portal, Deputy Director of Public Health for the county. So I think, let's see if we can pull the graphs. Thank you so much. So total case count as of today for the county is 777 cases of COVID reported. We are currently monitoring 162 contacts at this time. So as you can see, we've seen a pretty steep increase since about the week of the 23rd of November. I just wanted to show, I I looked at data from the first 2 weeks of November. We had, so from the 1st to 15, we had 22 cases, which put us at a case rate of 44 per 100,000 population. And at this time, if I'm looking at the past 2 weeks, we're more than 6 times the case rate we were at that time. So we're at a 301 per 100,000 population for the past 2 weeks, which definitely confirms the fact that we are going to move into the extreme risk category on Friday, the 18th. That, you know, that also means that we, the increase has been pretty steep and rapid. We, at this time, have 135 cases for the month of December, so from the 1st to today. I looked at the first week and then the second week of the month and tried to see if we had, you know, any type of difference. And we're steady at 67 cases for the first week and 68 for the second week. You know, we had to surge, which means that in order for us to be able to investigate the reports of confirmed and presumptive cases that we're receiving daily, we had to staff up our team with various search teams. So right now we have in place 3 levels of search, meaning that if we receive a certain amount of cases in the morning, so we have a staffing meeting every morning with the core team, so the nurses, and if we get to a certain threshold, we activate search team 1, and pretty much those folks are kind of leaving their duties to help us investigate cases. And then when we reach a second threshold, we activate the second team and then the third team. That's been working really well. We've been, you know, kind of tweaking for efficiencies and efficacy and make sure that, you know, we're staffed up every day of the week. I'm very happy to report that the team is functioning extremely well. I think we gained in efficiencies, and also that we are on top of the cases being reported to us, meaning that we are able to handle the caseload of the day that day, which I think is a very big deal, because that helps us not only identify contacts of those cases, put them in the system, and then start the contact tracing really quickly. But that also helps us, you know, possibly nip some outbreaks in the bud and really talk to people and answer questions and things like that. So, of course, you know, the expectation, or at least my assumption, is that we might stay at this pace in terms of cases, or possibly go up. You know, we're about to enter winter time. We're about to spend even more time inside. And with the holidays coming, even though a lot of people, you know, followed CDC and OHA recommendations for Thanksgiving and canceled their gathering plans, or, you know, did Zoom calls for this holiday, there's still a lot of people that, you know, decided to take that risk, and we're seeing definitely the impact. So we're anticipating that the increase is gonna remain for quite some time. So it's very important for people, and I know this is tiring, and I know that everybody's tired of hearing us saying this, but please wear your mask and wear it properly, like cover both your mouth and your nose. Wash your hands often, and be physically distant of people. And even when you hang out with folks from a different household, please wear a mask and continue with the physical distancing. So, I don't know if you want to, so I discuss kind of like so you see clearly the trend upwards from September with 16 cases to mid-December with 135 cases. You can scroll down. Let's scroll down again. Yeah, I've talked about this. So we've also seen a little bit of an uptick in people being hospitalized, over the past few weeks. We hadn't had any hospitalization for a few months, and we've had some. Yes?
Well, I wanted to ask a question relative to the slide that shows the number of cases per 100,000. I think it's the previous slide. Yeah, I'm a visual guy, and I'm wondering, the question I had, and I was waiting to see the slides, is there a way we can show on one of these slides where the threshold is, if you will, to go from extreme to high or the other way around? And I think this would be a chart where you could draw a red line that would say, above this line is extreme and below this line is high risk levels. Or
that line is 200.
Yeah, well, I guess what I'm saying is it would be nice to put a red line there and maybe put an arrow up that says extreme risk and an arrow down that says high risk. That way people that look at the chart, I think, could easily understand, are we close to one or the other? Are we heading in the wrong direction? Or are things just going to be this way for a long time?
Yeah, absolutely. I think this is a great idea, and I'm sure Susan is going to be working on this, or probably is already working on this. So just as a kind of a benchmark, 200 cases per 100,000 is the benchmark for us to go back down. So definitely the trend is going in the wrong direction at this time. So we can see that the increase is not as steep, those past 2 weeks compared to the 2 weeks before that. But still, we're still going up. So we would need to go down for a lot of things to reopen, for kiddos to go back to school and all that.
I might add, I like that graph because it shows 3 2-week periods, consecutive rolling 2-week periods. So
right.
It's a good chart.
Commissioner Hall, questions or comments from you?
I wasn't necessarily done.
Oh, okay,
I'm
sorry.
so sorry.
Yeah, and I
If you want, we can do questions on the data, because I wanted to also discuss testing events and vaccine planning. So it's up to you if you want to ask questions on the data part of the presentation.
Yeah, let's do data questions now. I think that might be helpful, and then we can move on to the other stuff if you're okay with that. Okay, so Commissioner Hall, data related questions.
Okay, thank you very much. And, I just want to say and kind of emphasize that's very good news that the surge team structure is working. I think people who do follow the news nationally about the efforts to manage this virus, you see many news articles, unfortunately, about counties essentially saying that their caseloads are rising so rapidly that they are giving up or all but giving up on contact tracing. And I'm glad that our team is still, despite this awful surge, is able to keep up. A question that I continue to get, and the answer that I'm sharing with people, but from our previous meetings, but I'd just like to know if this continues to be the case, if you have any further observations on this, people keep saying, where's this all coming from? And, is it still the case that we're looking at workplace spread, informal social gatherings in which people aren't following the guidelines? Insights that you can offer on that. Thank you.
Yes, definitely, Commissioner. I think what we're seeing is workplace related and mostly social gatherings and household gatherings, and, Thanksgiving gatherings.
Thank you.
I had a kind of a follow-up to Commissioner Hall's question on where is this coming from. It's been a couple of weeks now since Thanksgiving, so are we beginning to see outbreaks related to that holiday?
We've seen a few, for sure. I think where it's coming from also is that we finally catching up to the rest of the country and the state, right? We are just, because we're less populated and, further kind of like removed from big population centers, we haven't been impacted as much as fast in, with the numbers that other areas have. But regardless, those numbers have increased enough that it's impacted us all now, and really fast. This is what is really interesting to see is the exponential rise, and really to see that in a few weeks we went from, hey, we're good, we're moderate, we're in the yellow, and bam, 2 weeks later we're ready to move to the red. So I think there are ways for us to curve that. We've done it before, but we really have to work at it together as a community, because otherwise I'm afraid it's going to be hard to see numbers go down.
Okay, keep going.
Okay, so
Question still. If I may, Chair Jacobson.
Go ahead. Data related.
Yeah, the only reason I interrupted when I did is because my question was pertinent to that slide. So if I've created confusion, I apologize. But since we're talking about data, do we have a slide that will show the percentage of positive cases, which is the other criteria for which risk category the county is in? And I understand that we may not, because the state, as I understand it, isn't providing us the number of tests. So how can we know the number of positives? Is that accurate?
No, that is not accurate. No.
Good.
Maybe I misunderstood. Can you slide down? I don't know if those have been. Can you scroll down? Sorry, Casey.
Maybe they're not publishing it on the OHA website.
So what has happened is that the way the positivity rate has been calculated has changed. So before, I believe 2 weeks ago, let's say you're this one person and you go get tested 10 times, we will count you positive only one, okay? But now they're doing a test-based positivity rate. And so every time, so for example, you go get tested and the clinic does a rapid and a PCR test that same day, we will count 2 tests. Okay, so we're counting, so now we have a larger denominator, but also a larger numerator. And so it's very likely that our positivity rate is gonna go up also. I think when I was looking at the dashboard, we were in about 8% positivity. But that is likely because of the change of methodology. So we're gonna have to look at that new data starting, like I said, probably like early December and looking at the trend from early December forward.
So do we have a chart that shows that data?
Yes, we do. And so I don't know if it's on that slide deck, but it's on the dashboard otherwise. Go back up. So, No, go down, down. Okay, thanks. Do you see this big jump here? Historical DACA positive test rate. In fact, we can't really, I mean, it's because it's two different methods, we should almost have two different charts with, because right now we're comparing positive test rate where we shouldn't really put that on the same graph. But anyhow, we see a big increase, and this is what I was explaining, because we increased the denominator and the numerator, and so now we are going quite up. So, but I think we will do a different chart next week where we're going to start tracking at the 8.2 and moving forward, and see how that new.
Morris, this is Susan. That chart is on here. It's towards the end.
Yeah, I know. I think I've been discussing it. Which one? There is one that is actually being provided.
Susan, how far down?
No, that's not that.
The one directly above that. Above.
No.
Those purple ones, the bottom,
Yes.
the 8.6 is the positivity rate.
Yes. So what I was discussing your previous page was also talking about this. But what I was trying to say is that it's because they changed the calculation. We might want to do a different chart because we're comparing apples to oranges at this time, and that shows this huge increase. In fact, the increase could be related to the change in calculation. Anyways, we will address this later. But yes, there is likely some increase. Is it as steep as what we're seeing here? Maybe not.
Okay, well, we can take this conversation offline, but I would like to see generally a chart that has the same structure, if you will, as far as the number of cases per 100,000 for the percentage of positive.
We'll do that.
Because again, that'll give people a visual idea of, are we close? Are we going the wrong direction? And I think that would be helpful. So good information. My last comment would be certainly echo Commissioner Hall's comments, and I'm sure Chair Jacobson supports the great work that public health has done. I think there's been a lot of innovation on how we're trying to address this incomprehensible challenge. And I think, kudos to not only the public health staff, but all of HHS staff that have been innovative in trying to address this. And the fact that we're able to stay on top of it, I think speaks highly to the job that's being done. So good work.
Thank you so much. I will make sure to pass it on. So I also wanted to discuss the fact that we're working on putting together two new free testing events in December. So one is scheduled for the 23rd, 9 a.m. to 1 p.m. In Lincoln City at the St. Clair Fire Station. And the second one is scheduled on the 30th, same time, 9 to 1 p.m. And it will be in Newport at the fairgrounds. So there's going to be a different registration system. The registration is required for everybody. And so let's say that a vehicle has 4 people who want to test in that same vehicle. There needs to be a registration per person who is going to take the test. The registration site is www.doineedacovid19test.com. People can get help if they need to get help. They can call the call center, and Angela and her team will be happy to help. And then, and we're also trying to schedule more events for January of 2021. We're just waiting for the state schedule, and I know they're going to change teams. So, but we're definitely, I think we made a very good impression in November, and so they're pretty eager and happy to work with us, which is really good. And then the last part of information that I wanted to give you was on vaccine and vaccine planning. So, of course, vaccine is all over the news now, and it's really positive. We have a little bit of information from the state about kind of what they're expecting to receive. I believe tomorrow they're going to receive about 35,000 doses of the Pfizer vaccine, which is the vaccine that requires the ultra cold storage. And those 35,000 doses have been already allocated to be administered to healthcare workers who work in, hospitals where they are exposed to COVID cases on a regular basis. And those hospitals have been identified, and I believe it's 5 hospitals around the metro area. And next week, they will receive again some doses of the Pfizer vaccine and then the Moderna vaccine, and every week the number of doses is gonna increase. There is also a very defined way of how the vaccine is going to be distributed. And so we will start entering what's called phase A. There are 3 phases, A, B, and C. And phase A has 3 subcategories. The first one is healthcare workers and long-term care facilities. The second one is essential workers. And the third one is people over 65 and people with, kind of like comorbidities. So, we're definitely working with the region and the Samaritan Health System and our neighboring counties to have a very coordinated and collaborative approach to how we're going to distribute and administer the vaccine in the region. And we also started an internal planning work group within HHS and the county, where we brought in our colleagues at emergency management to help us with logistics and starting to think about, points of distribution and all of that. So this is what I've got for you today.
All right, thank you. I have a couple of questions, and then we'll go around and take questions from others. You said that the vaccine distribution has a A, B, and a C component to it, and that A was healthcare workers, essential workers, and people over 65 with existing health conditions. What's B and C, or is that defined yet?
It is defined. I just need to find the email because I think otherwise I might miss something. I believe B is more like the minorities population and people who have been more affected with the spread of the disease. And then C is the general population.
Okay, thank you. That's my question.
Mm-hmm.
Commissioner Hall, questions?
No, not beyond what we've already discussed. Appreciate the report.
Hey, Commissioner Hunt.
No, nothing at this time. Nothing more at this time.
Okay, thank you, Florence, and thank you, Rebecca. And I do think we still
Thank you
have
so much.
some COVID-19 things to discuss. We have our Small Business Emergency Grant Program. I know Council Belmont and Janet Harrison, our paralegal, have been working very hard on this over the weekend. Very, very tight turnaround. So Council Belmont, I'll turn it over to you to give us an update on that.
Thank you, Chair Jacobson. And yes, this is the money, the $55 million that the state provided to all the counties in Oregon to provide some small business emergency assistance for those who were impacted by COVID restrictions. We set up our program working with the Small Business Development Center, and Northwest Oregon Works, our WIB services provider. And I just want to do a quick shout out to them. They have been a tremendous group to work with, both on the technical side, determining how to pull this off in a very short period of time, and then in terms of giving general advice and guidance for how we can get this money out into the community in a reasonable fashion in a short period of time. And then a very special shout out to Janet Harrison from my office. She has been a stalwart in pulling this together, in really reviewing a very complex set of data that we've got here and assisting in the process of reviewing the applications. So we put out the criteria, we put out the call for applications. I know I reported last week that we anticipated we'd get quite a few applications, but I think we were somewhat, I guess I'd say pleasantly surprised in the number of applications, but maybe more, it's an indicator of how much suffering is going on in the business community too, as we deal with the restrictions here and move forward dealing with COVID. So we ended up with just under 350 applications. That was more than I expected. I was thinking more in the neighborhood of 200 to 250. So it was instead 350. And as you recall, under the program that you authorized us to do, we identified applicants in 3 different categories. Really small businesses, meaning solo entrepreneurs through 3 employees, 4 to 7 employees, and then 8 to 25. So they're still all small businesses, but in different categories there. And so I did a quick calculation, and we have not at this point determined that all those applications are eligible. We're in the process of undertaking that review now. And there may be some duplicate applications that are involved there. So we're going to do that process first. But assuming, just for the sake of argument, that all 347 applications are eligible, and at the amounts that we were trying to identify for those particular entities at the various sizes that I described there, we would actually be awarding over $2.7 million. And we don't have $2.7 million. We have $900,000. So as you can see, and we sort of anticipated we were probably going to have to make some adjustments. Nobody's going to be getting that maximum amount of money. And instead, we're going to go through and determine where we can provide money to as many businesses as we can with the criteria that were established both by the state and by you locally here, and try and get this money out into the community and across the entire breadth of the county. I was pleased to see we've actually been able to look at the applications by zip code areas, that we got applications from all parts of the county, which was great. And so I forgot to mention one other group, thanks to the Chambers of Commerce in Licking County for assisting us in getting the marketing out there to get people to apply. And Dave Price, of course, with the Small Business Development Center, was our technical guru who helped a number of people in putting together their applications. So we're going to be in the process of reviewing those. We're going to have to make some tough decisions coming up here, but we anticipate actually making awards hopefully by Friday of this week at the latest. And then the money will be getting out in the next week or so. So great process, a lot of businesses that are in need, and we hope to assist them in the next coming weeks.
Thank you, Council Belmont, and thank you, Janet and Dave Price and all of our chambers and our translator, Fernando, and just the team of people that have come together to not just get this out, but get this out really quickly and review it really quickly. I know our city managers have been helpful as well. And so just thank everybody for kind of making this work as fast as we can to help our businesses. I don't have any questions about this. I have some other questions for you, Wayne, but I'll hold off on those and see if Commissioner Hall has questions about the business grant.
Yes, I do. Thank you, Madam Chair. Mr. Belmont, again, I know in the past we discussed, could you kind of reconfirm for us? And wow, I know this is going to be a huge challenge in terms of staff time for review of the applications, but what we're looking at least as a tentative timeline for that review to be completed, for letters of award or denial to go out and checks to go in the mail. Can we state that publicly, or is it still too much in flux at this point?
I think it's in flux, although I can tell you this, we're going to try and get through making the decisions on the awards by Friday of this week. That, I mean, again, these are all subject to, that review process is very time consuming. And that's what we're anticipating now. We're doing this on top of the other work we're doing, in our daily job. So, but we're anticipating that we actually can make the decisions on the awards, and then it'll probably be a process of getting it out to the community out here, both in terms of who gets the awards and how much they're getting after the end of this week.
So follow-up question again, it sounds like, that we will be able to meet the goal, hopefully, of getting the dollars out the door before the end of the calendar year. Barring
Yes.
something we're unforeseen. You're
Yes.
saying it, great.
Yes.
Thanks, and thanks to everybody involved with making this happen so quickly.
Commissioner Hunt, questions or comments on the business loan program?
No, I think it's nice to see the interest, and it's nice to be able to help these businesses.
Agreed. I wish we had more money. Okay, moving on, Wayne, but still under COVID-19. I know we've had, at least I, speaking for myself, I have had a lot of emails this week ever since the announcement that we are in that extreme risk category. I've had emails from people saying, how come we don't enter extreme risk, right this very moment? And while this is a state framework that we are given, I know in some conversations with you, I know that there's some challenges and some barriers to us taking action, right this minute without the state's help. And I just was hoping you could maybe explain that a little bit, because I've gotten enough email traffic about it that I think it would be helpful.
Sure, I'd be happy to do that. And I think the thing to realize is this is a new framework just rolled out by the state to do a uniform response across the state, because that really is the way in which we're going to attack the surge at best, as if we do it across the board here. So unlike the previous framework in which the county could actually request to be placed in a specific category or move up or down in these categories, this is a straight numbers game. These are, there are metrics that are being applied across the board to counties, and they move you up or down inside those particular metrics to the kinds of restrictions you're going to face in any of the categories that are utilized here. So we don't really have a role in deciding where we're going to be. This is something that's, again, done by the numbers. I do want to note that there is no application the county makes. There's no process for us to go to the state. It's interesting, executive order, as it was finally crafted, does give a county the ability to stay at a higher risk. So if we wanted to stay in extreme risk longer than the numbers showed, we could make that request to the state. That's the limit of what our authority under this particular scheme is to move forward here. There's been some discussion around other local regulations that we might want to do. And of course, we attempted to do something with short-term housing before, but there we had the participation and cooperation of everyone across the county. Again, it's the same kind of scenario. In order to make anything work here, you're going to need to have that cooperation and participation. But I think there's a real desire at this point to utilize the state framework here, to put it in place, to give the restrictions a chance, and then to look at our own accountability as members of this particular community to adhere to the requirements and restrictions here, to really wrap our arms around this particular surge and see if we can't get it under control.
Madam Chair, could I jump in kind of with a follow-up on your question and Mr. Belmont's response? So I guess maybe a different way of looking at it, people are probably wondering, and I mean, I know we can't speak for the state, but why the state, I guess, only wants to move a county up or down in risk levels every 2 weeks. Again, I'm getting, I think, some of the same kind of questions Chair Jacobson is getting. If we meet the numbers to go into extreme risk, why is the state waiting to move us? I think I could speculate on some of the reasons, but is there really, I'm not sure if I've seen that explicitly stated by OHA or the governor's office.
Well, it's my understanding, and I could have Director Austin maybe correct me if I'm wrong with my understanding, but the way they were doing this has some pretty significant impacts on businesses here, opening and closing businesses. And so they want to give some lead time, both for, let's say, a classic example is a restaurant. If you're having to go one way to which you're not doing any in-person dining, you may have a stock of goods, you have payroll and employees that you've got to have some time to be able to move them to the next phase, whatever you're going to be doing. And it's the same thing moving back in. If you're going to move into a lesser restriction in the future, you need some time to gear up. You need some time to put things together. So I think this was really an idea that the best way to look at this is in 2-week increments, and to move that way. That the warning week concept there is to give you some indication of which direction you're going. In our case, we just moved. The warning week was portended where we were going to be at the end of that time frame, and very clearly, there's no way we could have actually, if we had no cases, we would have in the last period of time here, it wouldn't have mattered in terms of where we're headed right now. So I think, again, it's an idea that you can't just move from day to day on these things. You need to have some lead time to do it. But it also, puts some pretty stringent requirements on folks if you're in that high risk category.
Okay, Commissioner Hunt, anything to add to that?
No, I think Council Belmont's response was right on. I mean, if you're trying to run a business, you've got inventory issues, you've got staffing issues. And I think by going to a 2-week rolling average, you avoid the whiplash, if you will, of going one direction and the other direction too quickly. So, it's maybe not ideal, but I think it does provide a tool through which businesses can maybe more effectively manage their businesses.
All right, thank you. I think we'll move on from the public health COVID-19 update. I think we got through that. So thanks, everybody. Moving on under reports, under item C, acceptance of Samaritan funding for non-congregate housing. And Council Belmont, do you want me to set that up or do you want to set it up?
How about if I just say a couple of things here and then you can actually talk about it because you were very involved in this particular matter. As we were looking at responses to COVID, one of the issues that we had to address was not only the fact that we have a number of people who are at risk because of medical conditions, because of vulnerabilities, age, those kinds of things, but it isn't just the general population in the community, it was also our homeless population in the county. So we had to make some decisions going forward in terms of what do we want to do as a county to deal with some of the homeless issues, the immediate homeless issues that we're facing in light of the COVID pandemic. And so one of the things we did was we did a program that got some funding from FEMA and from the CARES Act to cover what we call non-congregate housing, which is basically putting people up in hotels. And while the focus initially was on people either who were positive or presumptive for COVID or were because of reasons had to quarantine outside their family or isolate outside their family, we got these particular sheltering options in place to handle those particular populations. But we extended that initially to include some of our most vulnerable population, which is the homeless. As you're aware, a number of the places that people stay who are members of the homeless population are in very congregate kinds of camps. The camping outside of the city limits or inside the city limits can be very crowded conditions there, really are potential grounds for the spread of COVID. And so we were very concerned about that population and those who needed to have, some kind of sheltering. Since then, our discussion with our partners in the cities, nonprofits that provide housing, is really extended to say we need to provide a non-congregate sheltering option for homeless to cover all situations this particular year in the midst of COVID. Not just the COVID situation, but anybody who is homeless. And so our hoteling program, while it covered those populations who were vulnerable and at risk, has been expanded now with our partners to really cover this as a housing option for homeless for at least this coming year for everybody that we can actually provide housing for. So we've been seeking resources to assist us in that particular process. And with that, I'll turn it over to you because we have found such a resource.
Yeah, thank you, Councilor Belmont. So just adding on to what he had said early on, we began hotel sheltering people. Part of what allows us to do that is the FEMA non-congregate housing exemption, which runs out 12/31/2020. And we're still in a pandemic on 1/1/2021. I mean, we still have a homeless population on 1/1/2021. So I'm working with partners here. I was able to dust off my grant writing skills. It had been a while. I felt a little rusty, but we were able to bring in about $70,000 from Samaritan to basically continue that hotel sheltering program for our homeless population into 2021. How long that lasts depends on how many people need rooms, obviously, and the rates that we're able to get moving forward. But we at least should be able to get through sort of our peak cold months where we're most worried about people being on the streets. And again, this is in lieu of that kind of traditional congregate wintertime sheltering because due to COVID, it's super risky to have a group shelter situation. It's also probably difficult to find volunteers willing to do it this year. And additionally, I think the thing we don't talk about enough is getting people stabilized in housing, even if it's a hotel room, provides benefit beyond what a temperature trigger shelter does. If you have a place, if you have a mailing address, if you have stabilized housing for a while, it allows you to get on your feet in a way that a wintertime night-only shelter does not. So there's been some benefit to people being able to access services, get on medications and access mental health and apply for jobs and things that were difficult to do just from a nighttime sheltering perspective. I am going to put Tony Campa on the spot. I see his little name icon. So if he is listening, maybe he could just give us a really brief update on how things are going with the rooms we have both in Lincoln City and in Newport, if Tony is listening.
Yes, I am. This is Tony Campa from Lincoln County. Work with Community Justice. We currently have 21 rooms in Lincoln City at the Ocean Breeze Motel, and then we have another 20 rooms in Newport, Oregon. And we're able to provide housing to those in need based on the criteria that you guys just discussed, which is pretty much anyone who needs sheltering at this point. We also assist people with other areas of need like phones and food and transportation, those type of things when needed.
Great, thank you, Tony. And even though we have a set number of rooms that we have at each hotel, there's been times where we've had to swell up and find additional rooms, and we try to do that as best we can so that we're not turning people away. And also, even though we have Tony from Community Justice running that program, I just want to reiterate, you don't need to be a justice-involved individual to access it. Just like many of us right now at the county are doing our regular jobs and then our COVID/wildfire jobs, Tony and his team have stepped up and has taken this on in addition to what they normally do as well. So you do not have to be justice involved. It just happens at our justice department, and Tony has some capacity and interest and big hearts and are willing to take this on. So that's kind of my update, I guess, in terms of winter sheltering. Wayne, anything we need to add in relation to the money?
Yes, and actually we've done the internal process of doing our grant concept paper, turned that in, so we know where we're going to actually put this money and utilize it and what we need to do to report on it. But we do have a deadline here coming up that we need a motion for the board to authorize an execution of the letter of acceptance for this particular funding. And we'll get that then turned back into Samaritan. And I did want to note that this is actually money that's available because it comes from the social accountability budget of both North Lincoln and Samaritan Pacific here in Newport, that it is money that's available for hotel rooms in Newport and in Lincoln City.
Wonderful.
Madam Chair,
Yes,
I'm sorry. I would like to make a motion that we authorize approval of the letter of acceptance, but I was just wondering if I could ask a couple more questions.
sure.
When we've been discussing this program in the past, I believe there's been discussion of some other nonprofit community partners being involved with this, and are other folks still at the table, or is this primarily a community justice operation at this point?
There's a few different things happening. So Chance and Gracelands also have kind of teamed up, and they also have rooms available through other funding sources. So they have rooms and we have rooms. So there's kind of two programs happening, though I know Tony and Graceland and Jeff Blackford from Chance are all kind of in communication with each other and call each other and text each other to see, who has rooms. So there is nonprofits involved. And beyond that, referrals come from all kinds of nonprofits, including the hospital itself, including from our own behavioral health, as well as other nonprofits in the community that make referrals for individuals. So there's lots of partners involved on this. And in terms of operating the hotel rooms and staff, the program we just talked about is ours. And then, like I said, Chance and Gracelands kind of have their own on a smaller scale.
Okay, great. And you already answered my other question, which I've heard from a couple of people, is how are people referred to this program, but through basically existing community partners. Well, this is all great. And, I know I hear from time to time folks concerned because the usual winter warming shelter is not happening at the county commons. And I'm reassuring them that just because that's not happening, it doesn't mean that people aren't being taken care of. And so again, I just want to hats off to everybody who, including you, for writing the grant, and for all of our team and partners, Tony and his people, because I know, that their responsiveness to the hotels has been a big part in standing this up and maintaining positive working relationships with both facilities. So, thank you to all who have made this happen.
And I know we do have a motion on the table. Mr. Hunt, is there anything you wanted to add, though, before we look for a second and take a vote?
No, I was waiting for Commissioner Hall to finish her comments, and I'm happy to second her motion.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Aye. And then it looks like there was one more thing Tony wanted to say, because people can make a referral directly. So, Tony?
Yes, for the referral agents that are out there, the on-call number for housing, if you have a need, is 541-270-9395.
Great, thank you, Tony. So people can call that directly, and while there's typically referrals from agencies or nonprofits, I know we have gotten referrals from just citizens that see people that look like they're in trouble or need to be housed, and we've gotten referrals that way as well.
Wait, well, if I could, one more question, Madam Chair. We've got a lot of information flying here. Again, the amount of this grant from the Samaritan Fund is how much?
$72,500.
Great, thank you.
Very good.
All right, moving on, under item, let's see, where did we go here? Under item D, Community Outreach and Recovery Education Corps, serving Lincoln County, presented by Shelby Houston, Cheryl Fisher from Lincoln County Health and Human Services.
Chair Jacobson, if I may, I'd like to offer some initial comments. In my role as the commissioner that has Health and Human Services reporting directly to me, I participate in a lot of different meetings, and there are a couple of programs that the county has initiated that I think are critical value at this time. Certainly with the challenges of the COVID pandemic and the length of time that we've been under those stresses, and you add to that the wildfires. Certainly behavioral health has become more and more topic of concern or relevance as we address the health of our citizens. So there are two programs that I asked to be presented because I think they're extraordinarily valuable, and also the more awareness we can create, the better we serve our citizens. So the first one is CORE, which is Community Outreach and Recovery Education. And then later we'll hear a report on, I guess I'll call it, well, it's the Early Assessment and Support Alliance program, both of which deal with delivering mental health or behavioral health services to people in need in these particularly challenging times. So with that introduction, turn it over to, I believe, Cheryl Fisher, who's the Deputy Director of Behavioral Health, and Shelby Houston.
Thank you, Commissioner. Thank you to all of you for having us in today to talk about some of the initiatives we're putting in place to try to reach out and help all of those that are struggling right now, either related to wildfires, just day-to-day stressors because of job insecurities, or some of the things we were talking about today about financial issues. And when we talk about our response to COVID, it's not necessarily that you have to have had COVID directly or a family member had COVID to access our services. It could be you have been impacted in one of these other ways, financially, jobs, or other support. A lot of people are feeling really lonely right now. So again, thank you for having us in to talk about this, and we'll be back a few weeks from now to talk about ESA as well, as you just mentioned, Commissioner. So we are from Behavioral Health, and I wanted to just give a quick background. Obviously, we wanted to pitch in and help as quickly as we could with all the things coming up that we had to go through. And unfortunately, there's a lot of laws and rules and red tape around behavioral health that keeps us from just jumping into things sometimes. But we were lucky. The fires and COVID, some of the rules have been lifted, and we were able to do things to jump in right away. I'd like to thank the entire behavioral health team. They have just been troopers to pitch in. I think both Commissioner Jacobson and Wayne Belmont just mentioned, we all have our regular jobs, and then we have our COVID and our fire jobs. And so thank you to the entire team for that. But Jennifer Beckner was able to initiate some FEMA grants for behavioral health, and we were lucky enough to earn some of those, which would allow us to jump right in and help the best we could in the community without a lot of red tape. And so that is what we did. We developed the core team, of which Shelby Houston, who's on the line, she is leading, but we've got a great team with some other behavioral health case managers, Amanda, Connie, Diana, and Jody, and they represent children, adolescents, young adults, and adults. So any age can access the services Shelby's going to tell you about. The core team has the goal to do community outreach and recovery education. That's what CORE stands for. And we have a couple of different ways we're trying to do that. So please don't hesitate to access these services. If you're hearing us now, you don't have to be in a crisis to access these services. And Shelby's going to tell you all about it. She is our go-to person for this team. So thank you, Shelby. I'll turn it over to you.
Thanks, Cheryl. Yeah, so I'm excited to be here today to talk about the CORE team. So this is a newly formed behavioral health response team designed to help with the impacts of COVID-19 in our local wildfires. And CORE stands for Community Outreach and Recovery Education. As Cheryl said, our team consists of 5 mental health outreach workers. All of us have education and experience in the mental health field and in outreach, and it's our goal to support our own community's resilience. And so we can help by providing short-term mental health help. What we're finding is that there are people in need of mental health support, but that not everybody wants or needs ongoing support. This is where CORE fits in. We're wanting to help folks get through this unusual time by providing short-term mental health support so they can build their own resilience. So if somebody is feeling overwhelmed because of COVID-19 or the wildfires or the related impacts, we can help with that. Or if they're struggling with uncomfortable feelings like fear, loneliness, loss, or grief, we can help with that. Or if they just need somebody non-judgmental to talk to, we can help with that as well. We can also provide short-term case management to help connect folks to resources and entitlements that are related to the impacts of COVID-19 and the wildfires. We know that working with a bunch of agencies and filling out and submitting paperwork, remembering upcoming deadlines, all of that can be really confusing. And this is something that we do in our usual mental health jobs. This is something we're all pretty good at. And it's important to note that we are not a crisis hotline. We encourage anybody who may be having a crisis, a mental health crisis, to call the 24/7 Crisis and Information Hotline. And that number is 1-866-266-0288 or 911 if it's an emergency. And it's also important to note that we do not do therapy, which is a longer term, more structured intervention that's not appropriate for outreach. The short-term mental health supports that we do provide, like education about normal reactions or coping skills to help manage stress, and similar supportive interventions. These are designed to be provided within a couple sessions and can be accessed with very low barriers, like a phone call or an email or just a drop-in at the Salmon River Grange during our outreach hours. And another important piece of this is that we're free. This is just a service we're providing to the community. We're never going to ask for any money or any insurance. And although the CORE team is housed within Lincoln County Behavioral Health, we are a completely separate team and we don't share any identifying information with them or any other authority, so it doesn't affect documentation status to access our services. So right now we have a few different programs going on with a few more in development. We have Healthy Coping Strategies, which is the name of a weekly coping skills group that's going to be starting in January via the GoToMeeting video conferencing. This group will be held once weekly in English on Thursdays from 4 to 5 and once weekly in Spanish on Fridays from 4 to 5, starting on January 7th and January 8th. This group is open to all adult residents and will focus on providing education about the normal reactions to highly stressful situations, and on developing coping skills like mindfulness, healthy forms of distraction and self-care, creating connections, and other supportive practices. We're also offering one-on-one GoToMeeting training to anybody who isn't sure how to manage that video conferencing technology. All they would need to do is call us and ask for this, and then a CORE team member will do a one-on-one training session with them. The other big project we have going on is we have just started outreach at the Salmon River Grange to provide some supports for the wildfire survivors. So we are going to be out there on Mondays, Tuesdays, Thursdays, and Fridays from 2 to 3. And on Mondays, our CORE team member who is fluent in American Sign Language will be out there. Then on Fridays, our mental health outreach worker who is bilingual in English and Spanish will be out at the Grange. So right now, we have 3 ways to contact us, and we welcome community members if they are struggling and needing some help or have some questions about resources, they can just contact us directly and we'll respond to community referrals. So they can call 541-265-0403. This is it's a monitored voicemail line. So it shoots us an email when you leave a voicemail, and we have a response time of 1 business day. They could also email the Lincoln County Call Center and just mention CORE in that subject line, and we can email back and forth if they would rather prefer that route of communication. Or they can drop by the Salmon River Grange during our outreach hours. Are there any questions?
Shelby, could you repeat the Grange hours? I'm not sure I heard that correctly.
Yes, so we will be out at the Grange Mondays, Tuesdays, Thursdays, and Fridays, so just not Wednesdays, from 2 to 3 p.m.
All right, thank you so much, Shelby, and to you and your whole team, and not just for this moment in time, but I think you and your team are kind of the unspoken heroes of COVID and fires that deserve a lot of recognition for what you've been doing through this. So thank you for that. I don't have any questions. I know you and I have a lot to talk about, which we'll continue to do as we work through this mass process. So looking forward to working with you on that. But I will see if there's any questions from other commissioners. Commissioner Hunt, questions from you?
I don't have a question, but I'll take this opportunity to recognize Deputy Director Fisher, Cheryl Fisher, for the good work that she's done. She's announced that she's pursuing a regional opportunity, I believe, out of Marion County at a regional level. And if I understand correctly, we'll still have opportunities to interact with our county. So just wanted to take this opportunity to thank her publicly for the hard work and some of the innovative ideas that she has brought to the county. And
Thank you, Commissioner. I appreciate that. I'm actually going to be going to the CCO. I'll be coordinating the behavioral health regional effort with the CCO. So I will still be a big part of Lincoln County, and I'm looking forward to continuing to work with all of you. But thank you for those kind words.
Yep. Well, we appreciate your hard work and good luck.
Thank you.
Commissioner Hall.
No questions either, just kudos to the team, and I want to echo and second Commissioner Hunt's thanks and best wishes to Director Fisher, and especially since I'm on the CCO board, I'm sure our paths will continue to cross on a regular basis. So all the best.
Thank you for
Thanks.
those nice words. I appreciate that.
I'd say let's have lunch before you leave, but we're not going to do that in COVID. So we'll just pretend we did that maybe some other time.
Okay.
All right. Well,
thank you so much.
Yeah, thank you so much. And let's maybe have another update from your group in, I don't know, maybe a couple weeks or something as we move forward with mass and some other things. I think it'd be good to stay in touch. So thank you.
Good work.
Perfect. Thank you all. Take care.
All right, moving on to item number E, still under reports, STR licensing program update. We've received a ton of public comment about this today, which we'll look at here in a little bit, but I'm hoping Council Belmont can give us a little bit of a timeline on what we are looking at, because I think that's in a lot of people's minds right now is sort of how we're moving forward and under what timeline.
Thank you, Chair Jacobson. And yes, as obviously this particular agenda today shows, we've got a lot of things on our plate right now. I know in November when we talked to you last and gave you an update, we've identified some specific areas we'd like to explore in terms of making recommendations to the change to the code. We put some new services in place, including new software and new enforcement resources. But I think we had a little bit too ambitious of a time frame to get things together and pull this off before the end of the year, especially in light of some of the things that have occurred over the course of the time, since the time we gave that update. So what I would like to propose to you today is actually specific timeframes. And the biggest problem that we have had with this is we were not able to schedule what we had promised to do, which was public workshops and forums in which there would be opportunities for people to comment on some specific recommendations or to just tell us what they are thinking about our particular program, licensing program, and where they want us to go. Obviously, we continue to get individual comments on a regular basis at the board's email link on the Board of Commissioners page, and we'll continue to welcome those as we go forward here. But what we're looking at right now is I've had a pretty lengthy discussion with our IT director because we want to try and get a process, because we're still going to have to deal with COVID. We're still going to have to deal with virtual meetings in which we can actually allow people to come into a meeting and provide some input, as well as the methods we've been utilizing now, which are basically to send us materials or email us. So we think that we will have a platform available for this particular kind of meeting. We're working on a couple of options related to that. We'll have those in place before these meetings. And the two dates that we're looking at to hold public forum / workshops that we would like to schedule are Tuesday, January 12th at 6:00 p.m. And then follow that up a little more than a week later on Wednesday, January 20th at 6 p.m. And we'll get a lot of information out to everybody so they can understand how they can participate in this. They don't have to be at the meeting if they want to supply additional information, but we're going to look at trying to get some feedback on some specific options and recommendations, as well as open it up to other ideas and comments about the program. And then what we would attempt to do, the schedule would complete, but that's coming back with some options for the board, some specific language, and things to consider on February 15th at the Board of Commissioner meeting on that date. The one thing that we would have to do now, because that still hangs out here, and we had some discussion about this at the last meeting, is that we do have a suspension on new licenses that it continues through the end of this calendar year, just December 31st. And we are going to need to, if that's your pleasure at least, we want to recommend that you extend that particular order out for a further date. I know that there might be some desire to extend it out much further than even the February 15th date that we were talking about here, to ensure that we don't have to deal with this again, and I understand that. I think if you were to extend it out to March 31st of 2021, that we'll be able to complete our tasks and get things in front of you for adoption prior to that particular date. So I'll open up for discussion with the board as to what that date might be to extend it, whether you want to extend it and what that date might be. And then take any questions about the public forums.
All right, thank you, Council Belmont. So I think we're looking for discussion on possible date extension, if that's something we would want to do. And then also just comments on public forum. I guess I'll start with my comments. One is I am just really ready to get this done. And what I mean by get this done is actually have the larger conversation and discussion and potential decision making that essentially has been put off for all of 2020. That is not at any way a comment on that staff hasn't been doing their very best or that you haven't been doing your best. This year has just dealt us a lot of really hard cards to deal with. So we've had a delay and delay again, and I get that, but I guess when it comes to a date for me, I just want to make sure that we're absolutely giving ourselves enough time. Even if we had a little other things we had to deal with, like vaccine distribution or whatever it might be, that we are giving ourselves ample time so that hopefully, the date we extend to, if we extend to, that we can actually get the work done this time and truly, have these larger discussions and be done with this. So I guess I would almost say putting that kind of back on staff, but also on how long it's going to take to kind of sort through comments and things and us to read those from these workshops we're doing, and just making sure we really do have adequate time to do the work and have the discussions we need to have. So if you think, end of March or whatever is that date, and I'd go with that. I just really want to make sure that this time we're able to, barring any more disasters, knock on wood, that we're able to kind of get through that.
Well, towards that end, maybe I can do one quick comment because I just got a note from staff that told me that February 15th, the date I was talking about, actually ends up in 2021 being President's Day. So we're not going to have a board meeting on President's Day. That's a holiday. So actually, I would recommend that move to February 22nd. I think that actually is adequate time to do what we need to do and then to pull together all the comments. And what it really will be is, with the recommendations that come through is that you're going to have a lot of potentially, as we've seen in the comments that come through on here, you're going to have a lot of ideas that are really on all sides of this particular issue, ranging from get rid of all the STRs to don't regulate them at all. And you've seen that. And so working off the fact that we're looking at doing some amendments to our existing code, I think that actually we'll have those options, and what you'll just need to do is have that discussion, very public discussion about what you want to do and where you want to go. And I think we can make it by that March 31st deadline.
Okay, and then I guess my last comment I would have about the workshops, two things. Obviously there's going to want to be a public participation in that, and there should be. So just making sure we maybe have some practice sessions or something like that where people can get into the actual meeting site, making sure it's working before we actually do that, or people can log in a half an hour before or whatever, so that we're not having people that have technology issues and can't participate. So maybe a little practice or a buffer, if you will. And then second, kind of to your point about the comments received ranging from get rid of every single one of them to don't do anything about them at all. While people can certainly make comments on whatever they want, I think it would be nice to actually come up with some targeted questions or targeted things that we're actually looking for input on. We did give you and other staff direction here a few months ago on particular issues we wanted to look at, including occupancy and septic systems, the three strikes rule, and a potential cap or area cap. And I think targeting some specific asks for public comment around some of those things, I think that would be helpful, so that maybe we get, like I said, a little more targeted public comment that could help in that decision-making process.
And that would be our intention.
Great, excellent. Okay, Commissioner Hunt, questions or comments on the workshops and timing of a potential extension of the moratorium?
Well, I think your comments on the workshops are quite pertinent and valid. I will say that there are two words that I've heard in this conversation already that cause me concern. One is unexpected and the other is absolute. There have been many unexpected activities or events that have demanded staff time in the current year. And while I'm certainly appreciate staff's recommendation of March 31st, that needs to be absolute in my mind. I think I'm not interested in extending this beyond this decision we might make today. If my fellow commissioners are interested in a date beyond March 31st, I'm certainly interested in that discussion. If both of you are comfortable with March 31st, I'll support that, but it's got to be absolute, and I'll say no more.
All right, thank you for Commissioner Hunt. I would be open to adding a little buffer on that, just to make sure. Commissioner Hall, would you weigh in here?
Yeah, I am in agreement with everything I'm hearing from both of you. I guess a question for Mr. Belmont: if we are going to have this timeline of these public workshops on the 12th and 20th of January, I want to make sure, to Commissioner Jacobson's point, well, sure, people can weigh in on anything on this topic that they wish to. I think it would make make these workshops much more focused and productive if we could have the proposals published, at least several days in advance of the first workshop, so that people could respond to those specific proposals. Because, as you've said, we've heard, has been said, we've been hearing for months, if not years, the whole range of comments from do away with it entirely to lift all regulations. And what would be most helpful for me in my decision making is to have thoughtful feedback on the specific recommendations. But if you think we can publish those, do those workshops, and then have something adopted to go to the end of March, that's great. But again, given the history of 2020, I'd like to think things are going to calm down a little bit in 2021, but I don't think it's wise for any of us to count on that.
I understand that, and I think the idea will be that we'll put some specific proposals out there. They may not be in code language yet, the specific amendments, but there will be specific proposals that can be reduced to code language.
I might make a suggestion. Oh, go ahead.
No, Chair Jacobson, if I might, I guess I'd like to elaborate on that point a little bit. I think Commissioner Hall offers a good suggestion in that I'm not, I guess a time frame that would involve public input in a general sense and then additional public input on specific proposals to me is not doable in the next, roughly 90 days. So is it correct that it may not be in code, but the language or the concepts will at least be available for public discussion at those public meetings, and therefore there wouldn't be the need for additional public meetings with, I guess, ideas that hadn't been addressed.
I think that's correct. I think the idea would be we come out of this with some specific recommendations that we make to the board. Now, anybody can comment on the code language if they want to once it's done, but at least there'd be this is what we're looking at doing and proposing.
Well, I think certainly, obviously, we're interested in any public input, but I think the more we can do to focus it and have advanced knowledge of what possible directions this board might take, I think that's beneficial and expedites the process.
Yeah, I was going to make a suggestion that perhaps if we decide to extend the temporary moratorium on licenses, that staff's recommendation was the end of March, and maybe we push that until the end of May. I would like to have it done by the end of March. Do not get me wrong, I think that could still be our goal, but I think to give us an extra 60 days of buffer might be helpful, just given the year that we've had, and making sure, as Commissioner Hunt said, that this is absolute and we don't have to kick it down any further. And I just want to see if there's maybe support or consensus from Commissioner Hunt and Hall for that recommendation as well.
I like that. Could I ask Mr. Belmont a question? Just kind of a hypothetical. Say that we do vote to, extend the moratorium to the end of May, but everything chugs along at the end, along in this timeline. And say if by middle of March there is a new, a set of proposals we're ready to adopt, and that we're able to do that sooner, there's nothing that would, if we do go in the direction of modification or lifting of the moratorium, nothing that would prevent us at that time from changing it sooner, is there?
No, not at all. In fact, once you adopted something in the code that actually dispensed with that particular requirement, that that'll replace the temporary suspension.
Okay.
Hold on. Am I on mute or not? I can't tell. Okay.
Hear you.
If I may, Chair Jacobson, recognizing that the last day of May is a Monday, I would move that we extend the moratorium on STR licensing to Tuesday, June 1st, 2021.
Is that a motion or just a thought?
I move.
I'll
Okay.
second the motion.
All right. All in favor, say aye.
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 And commissioners will prepare an order that makes that so and put it on the consent calendar for next week.
Okay, thank you. All right. Whew. Long meeting today. Moving still under reports, we're under item F, ASA committee request 1-year extension for ASA assignments. I think Kristen Mule might be kind of starting this off for us, and then I think our fire chief, Rob Dahlman, is going to join us as well.
Hi, Commissioners. This is Kristen Yule, Assistant County Counsel. So currently, the ASA assignments are set to expire June 30th, 2021. And this extension would allow the assignments to have a 1-year extension. And so the new expiration date would be June 30th, 2022. And I'll let the committee discuss kind of what they've been doing and their proposals. That's it for
Kristen, one question for you before you pass it over is, when do changes actually need to be to us?
I'm sorry, could you repeat that?
Yes, when would the changes actually need to be back to the county?
So if the committee is going to continue to make amendments and changes, they would need to get those to the county no later than, I would say, April 1st, 2021. Because we will have to actually go through those, and if there's any code changes, that takes time.
Okay, thank you.
Uh-huh.
All right. Oh, there he is. I see him. Okay, turning it over to Chief Dahlman, and I think there might be some others you can introduce as well, Chief Dahlman.
Thank you. I'll try and be brief. So thanks for revisiting this issue. I know we've done it once before. All of our ASA committee, the Fire Defense Board, and both providers have sent request letters for the 1-year extension on this. Kind of just a little bit of history where we got started. We ran with looking at complete review of our ASA plan in August of 2019 and stopped in February 2020, as you well know why. A lot of staff time was taken up. Jenny Damaris assists us greatly on that. All the other fire districts had all of our things to do. So we wanted to get back at it. And then September rolled around, we had another curveball thrown at us. I think that Kristen has very well said what our dates are for when the extension would be and where we need to be. I forwarded on to Chair Jacobson our plan as to where we are currently and the changes that we've made. I can tell you that the changes, how we got to our changes, is we looked at many other county plans and we discussed the review process, and what we wanted to have was something that when it went to the Oregon Health Authority was very clean, something that mirrored other plans that they had already approved, so it wasn't that difficult for them. We wanted it to be easily read by the public and understood by everybody. So we worked really hard at that. We put a lot of time into it. We estimate that we need about another 2 more meetings and probably about 20 hours of staff time to finish those changes. I do fully believe that by April 1st, we'll have a document to the county that looks very good. The only thing that county council needs to do is section 7 on provider selection. That's the area in which they need to work on. That's something that the committee wouldn't work with. And then, as we talked about before, any changes or things that we wanted to add to the ordinance, if we were going to say add some monetary fines or things like that, that actually needed to be to county council by February. And so far, the committee hasn't come up with anything that we think would be workable or that makes sense in the plan right now. So that's about where we are. We had a brief email exchange with the Oregon Health Authority, knowing how overwhelmed they are and have been recently. They're still on track with their 30 to 60 day review process. And just today they said, keep us informed. And they didn't say anything like, oh, we're too busy to do that right now. So we still believe that the 30 to 60 day review process will be in place. Without any, if anybody have any questions for me or for the committee on what we've been working on, how we can move forward here.
Okay, thank you. Questions or comments from other commissioners? Commissioner Hunt?
Well, I sense from Mr. Dahlman's comments that the issues of unexpected and absolute are addressed with this recommendation.
Okay, Commissioner Hall?
No questions or comments. I think I appreciate the background. This is something we deal with every few years, and certainly, given the circumstances of 2020, I think the 1-year extension is justified.
All right, I am in agreement. I think originally when I got their letter, I think my thinking was just to give all of you more time because we understood how challenging this year was. But in conversations with you, Chief Dahlman, you had really emphasized that really you guys are pretty close and don't need more time than that. So I'm in favor of giving you that 1-year extension. A question for Council Belmont here, or Council Ewell. Procedurally, this was under report. Can we do a decision action item today, or do you need us to come back and do that?
Chair Jacobson, this is Kristen. I can prepare an order that approves the 1-year extension to be on the consent calendar for next week.
Okay, so do we have a consensus? So I see a thumbs up, Commissioner Hall. Great, okay. I think we have a consensus to move forward with that next week.
If I may, Chair Jacobson, I'll ask Council Belmont, since we're in a virtual meeting, are thumbs up visually an acceptable response, or do you need an audio record?
That's good. No, I think I think the thumbs up it still shows evidence that that's what you're desiring to do. And the proof will be in the pudding next week when you actually have an order on your consent calendar. There'll be a motion.
Okay. Well, just a random thought in a long meeting. My apologies.
Okay, it's certainly, we're still learning as we go here. All right. Thank you, Chief Dahlman and others for joining us today. And it looks like we will have that order on our consent calendar for next week.
Great. Thank you, commissioners. We very much appreciate this. Thank you very much.
You're welcome.
Thanks, Chief.
All right. Still under reports, commissioner reports. I feel like I've reported out on everything I need to report out on and some of our other topics, so I will pass. Commissioner Hunt, anything to report?
I'll offer my apologies for the recent iPhone ring. That was my grandson William, who's 2, wanted to FaceTime with Grandpa. So my apologies.
No worries. Commissioner Hall, anything to report?
No report, thanks.
Okay. Scrolling down our agenda here and looking at our public comment for today. I looked at it previously and quite a bit. So again, this is just walking you through where it's at. This is all the public comment that we received today. There's a few that came in after I had looked at them. And all of them that I saw at the time were all related to short-term rentals.
Chair Jacobson, if I might, maybe it's syntax, but this is the public record that we've received since the last commissioners meeting, not just today. I thought you said today. And I'm not trying to be picky, but I think so the public understands that's the public input we've really received since our last meeting. Is that correct?
I think that was today. So let me ask Christy to clarify that. I shouldn't say received today, but received in preparation of this meeting is the way I read it.
Right.
Go ahead.
Right. Yeah, but somebody could have sent some public input on Wednesday and it would be shown today.
Correct.
Yes, you're right. Yeah, go ahead, Christy, clarify for us.
It's everything that's been collected since the last meeting, last Monday on the 7th.
Yeah, my mistake if I said today. I should have said for today.
I wasn't trying to be picky, but I didn't want to confuse the public because their input is critical, as we all know.
So here is again where you find our smart sheets to put in public comments. And we request that it is submitted by 1 p.m. On Monday before our BOC meeting. Okay. All right. So, I think that is it for today, unless there's other business from commissioners. Nope, not seeing heads. Any other business from staff? Council Belmont, anything else from you?
Nothing more today.
Okay, we're gonna go ahead and adjourn then, but our next Board of Commissioners meeting is Monday, December 21st, 2020 at 3 p.m. and we will again be in a virtual format. Thanks, everybody.
And Madam Chair, but before you drop the virtual gavel, just maybe if we haven't announced it previously, that per usual board custom and tradition, we will be canceling the last meeting of the year, the one that would have fallen on Monday, the 28th.
Correct.
Yes.
Yes, we will be doing that. So we'll have a meeting on the 21st, but not the 28th. Thank you. Okay, meeting is adjourned. Thank you.
Thanks, everybody.
This conference is no longer being recorded.
Bye.